what does it mean for us as a team to help women with fibroids after years of suffering with distress, with this condition, to reclaim their peace and their peace of mind? For us, in one word, it means everything. Okay, and why do I say that? I say that because we've had women who are from all walks of life. Okay, there are women who you see at your job. Okay, there are women who you see in your schools. There are women who you see on the streets as police officers. Okay, and they're all basically presenting themselves as if they're at their best. But when they come into my office and they sit down, they breathe a sigh, and then they proceed to tell me that all is not well. We offer them this uterine fibroid embolization treatment, which allows them to have the entire conglomerate of their fibroids treated at the level of the roots, so that every single fibroid, whether it's the size of a sunflower seed or the size of a cantaloupe or grapefruit, fully treated. Right? We do this again through a 2mm incision in the groin, and where the women are back to work within a week, and where their symptoms begin to completely dissolve within 2 to 3 weeks post-treatment. Right? So this is a treatment that we offer here at the Bahamas Fibroid Interventional Clinic. Safety, security, comfort is something that we truly prioritize. When a woman comes into my office, the first thing that I want them to feel is that they are now a member of a very privileged community, okay? And it's a community that I deeply, deeply, deeply care for, right? And so when they come in, we want women to feel like, this is not a sterile environment. They are now getting an opportunity to tell me everything that they've wanted to tell somebody who can do something about it. So that is the first part of our consultation, where they just tell me everything in a very structured way. Once I have that information, I reflect that back to the patient, so that there's no question that I understand everything that they would have shared, okay? Then, which is very unique, we then focus on educating the patients in the same way that obviously our community on this platform is obviously being educated. They are educated so that they know everything that they've always wanted to know about fibroids, and then finally about the options for treatment, the pros and cons of each, okay? The ability to then ask questions. And at the end of that, the vast majority of patients say to me, wow, this was such a detailed interview, where they feel like they're interviewing me, and they say, this doesn't feel like a consultation where I'm in and out. This feels like I got to hear everything I wanted to hear. They feel like this was such an amazing educational journey that we were able to take them through from the minute they walked into my office to the minute they leave. The second piece is that patients get my telephone number, okay? And so now they're completely connected to me. I had a patient that I treated almost a year ago who reached out to me, for something in particular. And I was on vacation last week, and I responded, and she was like, wow, I didn't realize you're on vacation. Thank you so much for responding. And I told her, I said, this is a membership benefit. And she gave me, a little heart, which for me is symbolic of the fact that, again, patients know that even though a year later she's in a completely different world, fibroid-free, living her best life as a personal trainer, seeing the fruits of her labor, when in the past she would work out and wasn't able to see just her abdomen in the way that was reflective of the amount of work she put in, she's asking me something completely unrelated, and here it is. She feels like I am still showing up for her as I showed for her almost a year later. That is the level of commitment that we have for our patients, and that level of commitment immediately translates to comfort, security, and again, peace of mind, even before the patients get the peace of mind that comes from getting their fibroids fully treated by the uterine fibroid embolization treatment that we offer our women. We've had women that have had incredible outcomes post-treatment. One that comes to mind is we had a patient who is a customs officer who came in. She said to me, and I asked her how many pads she would use. She told me 16 to 18 pads. And I was kind of blown away. I said, well, are these for the first 2 days? And she basically suggested that it was for the entire length of her 5 to 7 day period, okay? Not only was this disruptive during her period, but of course now the anemia associated with this left her feeling as if her energy level was 2 out of 10, okay? She's now interacting with passengers as they come and they enter the country, and she is having to put her best foot forward. She's having to now report when there are times when she needs to call out of work. to her male supervisors what is going on with her, okay? So she went from feeling as if she was crawling out of her skin, super low energy, to the point whereby she just cannot do any better despite her diligent efforts, to now being 1 to 2 pads in a 24-hour period, basically for hygiene purposes having to change the second pad every day over the course of a period, to the point where her energy level is through the roof. She is the most cheerful person, interacting and greeting and welcoming passengers as they enter the country, right? That for me is an amazing, obviously, outcome for a patient who was a lesser version of herself. There's another patient who basically said to me, she had seen me treating patients. She is affiliated with our medical center. She saw patients coming in and out. And for about 3 to 4 years, she had seen hundreds of patients pass through the medical center. She works at our center. And I treated her. And before treating her, she said, I was just so fearful. And I just wasn't sure, to come to you and to get this done. And her husband said, we have absolute faith in you. And we're just so excited to see what happens. Within 4 weeks, this woman had lost about 17 pounds, okay? To the point where not only was her stomach flat, her entire body seemed as if she had a detox that just left her with just pounds left, just dissolving off her entire body. To the point where her husband joked and he said, Dr. Higgins, I feel like we had 2 procedures done, a fibroid treatment and a cosmetic procedure. And he was like, I'm so grateful. And so these are the kinds of examples, the functional ones where the energy and the bleeding completely dissolve. And then the cosmetic ones where women lose so much weight to the point now where they just look their best. They feel their best. And they are able now to be at their best. In others cases, they look at themselves and they say, wow, why is my stomach on the left bulging? To go from these distressing personal issues and professional issues to now being free from the issues of heavy bleeding, free from the issues of bulging under your abdominal muscles that you feel is visible and you feel other people see, and which basically means that for you, your sort of sense of self and your body image is just not where you feel like it should be, to now being able to sleep throughout the night and get restful sleep, to feel like your energy level goes from 3, 4, 5 to 8, 9, 10, to go to the point where you couldn't get pregnant because you tried and tried and tried and tried and tried. And because of these fibroids, these offenders to your fertility, you're now able to get pregnant, right? To take a woman from pre-treatment issues, symptoms, distress, to post-treatment, no issues, new lease on life, for me is everything. I'll tell you a story about a patient who basically about several months ago came to see us, okay? She was a patient from one of the family islands in the Bahamas, a very specific island called Eleuthera. And she was referred to me by a gynecologist. Why? Because she had essentially not only just super severe issues with bleeding, she was to the point where her bleeding was actually every day. We had done what we call an endometrial biopsy to rule out what we call endometrial pathology. And so we know that her bleeding was basically secondary to a fibroids and not because of some strange diagnosis that we didn't know existed, okay? So now we're dealing with pure fibroids, but she had some risks that would basically compromise her ability to get surgery, a myomectomy or hysterectomy by this gynecologist. So the gynecologist phones you and say, Higgins, I would love for you to see this patient. She's bleeding every day. She's a high-risk surgical candidate. I'm not sure if you could do anything because of the specifics of her high-risk status, but do you think you could see her? I see her in our teleconferencing platform, and she is basically on the verge of tears. She sees us as her last option, okay? So we take her from where she was, distressed, not sure what was going to happen, okay, to then within 4 weeks, she is literally telling me she just had a wedding that she attended and she had lost 15 pounds, okay? She's telling me now that her bleeding within a week had stopped, okay? She's telling me that she could now go to work and attend a meeting, a complete full meeting without having to leave to change her pads, okay? She's telling me that her energy level went from 2, 3 out of 10 to now feel 9, 10 out of 10. So when it comes to us at the Bahamas Fibroid Interventional Clinic, treating our patients, being able to take them from a season, what feels like a lifetime of distress, to now a new lease on life that is marked by deep, abiding peace of mind. For me, as I said, in one word, it means everything. Thank you. This is Dr. Mikhail Higgins, fibroid specialist and interventional radiologist. I would love to support you in any way that I can. Let's keep the lines of communication open and know that we are fully in your corner. Talk soon.